Hello, everyone, and welcome to the International Dysphagia Diet Standardization Initiative, or IDDSI for short, for administrative leadership. My name is Valentina, and I am a speech pathologist and a volunteer for the United States IDDSI Reference Group, which is an IDDSI-led country-specific work group to assist your organization in the implementation of IDDSI. Today, I will be covering the basics of what you need to know about IDDSI as part of the administrative leadership team. Following this short presentation, you will be able to define IDDSI and why it was established, list safety benefits, describe how IDDSI aligns with regulations, identify financial considerations, and estimate the timeline for implementation. The International Dysphagia Diet Standardization Initiative is a global texture-modified diet standard for all languages, all people, and in all settings. IDDSI consists of a continuum of 8 levels from 0 to 7, where drinks are from levels 0 to 4, while foods are from levels 3 to 7. Look at the framework. You can see how each level has words, terminology, a number, a color, and a symbol. That makes it easy to identify and learn. Your organization may have used the National Dysphagia Diet, or NDD, or a custom-made set of diets, both of which are subjective and lack standardization. The IDDSI framework is objective, has simple testing measures, and is based on the latest scientific evidence. The framework includes food and drink descriptors, along with instructions for easy, reliable, and accessible methods to test different foods and drinks. What does IDDSI stand for? International, because it has been so far adopted in 30 languages and has been translated into 13 languages with more to come. Dysphagia, meaning intended for people who have trouble chewing and swallowing. It is a diet guideline for describing texture-modified foods and drinks appropriate for people with dysphagia. It is standardization of diet orders to simple words that translate well. Each diet has a standard terminology, numbers, colors, and symbols. And finally, it is an initiative that started in 2013 to reach a consensus around the world on how to identify, describe, prepare, and serve safer food and liquid textures for people with dysphagia. Why does food texture and drink thickness matter? These texture-modified diets and thickened liquids are one important tool that the team uses to reduce risks of choking, aspiration, malnutrition, dehydration, and other negative health outcomes. Both children and adults with chewing or swallowing difficulties are at greater risk of food or liquid entering the airway. This is called aspiration. They may also have difficulty clearing food through the mouth, throat, and esophagus. Complex and person-centered decision-making is involved. Per 2019 data, choking is the 4th most common cause of death in the United States, accounting for 1.6 deaths per 100,000, and the incidence of choking rises rapidly for those over 70 years of age. Food texture modifications are often recommended by a speech-language pathologist who specializes in swallowing and swallowing disorders to reduce the risk of choking. According to this data collected in 2019, the incidence of choking rose rapidly for persons over 70. The risk of choking is high in infants, but even higher in older persons over 60 to 70 years of age. You can see the graph spiking at 164 deaths for individuals who are 89 years old. So how does IDDSI promote safety? The primary objective of the International Dysphagia Diet Standardization Initiative is to improve safety through common terminology for all ages, in all care settings, for all cultures. A current concern system-wide has been the guesswork and confusion that surrounds texture-modified foods and liquids. There are inconsistent diet texture orders between facilities, which can result in delays in receiving your diet texture orders. There is too much variability in the labels and descriptions of these diets. For example, some facilities have started to use IDDSI Diet Framework and descriptors, while other facilities are using old terms like mechanical soft that have no clear definition. Inefficient use of staff time to evaluate for diet texture recommendations, inconsistency in the quality and accuracy of food and liquids served, and there is a potential for sentinel events related to errors or confusion in the diet textures. So how does IDDSI resolve the current concern? IDDSI provides a common language for diet texture orders as individuals move through the healthcare system. With IDDSI, diet recommendations will no longer require translation as a person transitions between facilities or other levels of care. This increases patient safety and reduces errors when transcribing diets for new admissions. Implementing IDDSI at your organization has many benefits. Improving an individual's nourishment and hydration supports enhanced, timely recovery. Providing foods that allow individuals to safely eat at their greatest capability improves food and liquid intake and meal satisfaction. Food and nutrition services follow IDDSI's well-defined criteria when preparing foods and liquids, improving tray accuracy and quality. IDDSI promotes better communication and engagement between multiple disciplines, including your food service operations and culinary team, dietitians, speech pathologists, nursing staff, and medical staff. And finally, IDDSI is good customer service. IDDSI has the full support of the Academy of Nutrition and Dietetics, the American Speech Language and Hearing Association, and the Association of Nutrition and Food Service Professionals. As of October 2021, IDDSI is now the only professionally recognized standard of care for texture-modified diets in the Nutrition Care Manual of the Academy of Nutrition and Dietetics for the United States. Maintaining an obsolete set of diet orders that is no longer endorsed by these professional organizations could put you at regulatory risk. Regulatory compliance guidelines require facilities to align with accepted professional standards. Implementing IDDSI at your organization enhances your organization's ability to demonstrate regulatory compliance. Please refer to the Standards of Practice regulatory information for long-term care facilities, hospitals, critical access hospitals, home health agencies, and hospice document on the US page of the IDDSI website for further information. The cost of implementing IDDSI at any organization is widely variable, but no added labor should be required. Most people who have implemented IDDSI do not report an increase in food costs, especially long-term, but often do upgrade equipment such as food processors, which does help to control labor. As with any program change, planning time and implementation by the team, menu creation and printing is required, as is the corresponding technology update and interface testing. IDDSI can support your training efforts with free training materials on the IDDSI website, but administrators can facilitate adequate training. The IDDSI board has developed a three-stage implementation model, beginning with building awareness through activities such as this presentation. As an administrator, you are becoming aware of this best practice. It is the role of administration to support the facility's preparation and steps towards implementation and eventual adoption. As an administrator, you will be monitoring this process throughout. How long will it take your organization to safely and successfully migrate to IDDSI? A typical timeframe can be anywhere between 6 to 18 months, depending on the size of the facility, staffing, collaboration, and the organization's capacity for change. Start now and document well. When will your organization begin? To increase your awareness of IDDSI and learn more about this exciting change for the people you serve who have dysphagia, here are some resources you may want to explore with your IDDSI team at your facility. You can visit the IDDSI website at www.iddsi.org to find diet audit sheets, handouts, publications, webinars, and more. From the IDDSI homepage, you can find US-specific resources under the link of United States. You can also visit the IDDSI YouTube channel for additional implementation resources, such as webinars and examples of food and liquid testing methods. Support for IDDSI has been extensively researched. Detailed rationale regarding the need for international terminology and definitions can be found in our open access articles. Links to these articles can be found on the IDDSI website under the Resources tab, listed here in red. Gather your team, anticipate barriers, and provide solutions, such as having staff have adequate time for weekly meetings. The key to successful implementation is a few champions to start the process and planning. Assign a project manager from one of the following disciplines to bring together these disciplines to proceed towards a successful implementation. Look for the implementation guides under the Resources tab on IDDSI.org. These will help you plan, track, and document your implementation process. This documentation can be shared with surveyors when they ask your facility about whether you are working on implementing the internationally known best practice of IDDSI for all of your residents and patients who have dysphagia. Thank you very much for joining me today. If you have any further questions, please contact the US IDDSI Reference Group at USA@IDDSI.org.